I'm Fatima, and I'm a clinical lead in maternal and women's health at ORCHA, which is the Organisation for the Review of Care and Health Apps. I'm also an NHS clinical entrepreneur, and I'm currently an ST5 in obstetrics and gynecology in Worcestershire. So yeah, that's me in a nutshell, really.
Right, shall I go next?
Yeah.
So, my name is Ghalib. I'm the co-founder of Written Medicine. We're a provider of accessible medication information content supplier for patients with communication and language barriers. We created software due to experiencing communication barriers and language barriers in community and hospital pharmacies we worked in parts of central London. Currently, our software is being used in 4 NHS trusts and quickly expanding due to declaring BAME health inequalities, which is now becoming a priority at NHS England.
Great, thank you. And Henrietta?
Oh, hi. I'm Henrietta Mbeah-Bankas. I'm a registered mental health nurse, currently working at Health Education England as the head of blended learning and the lead for digital literacy for the health and social care workforce, also one of the NHS clinical entrepreneurs at the moment. It's me.
Great. So is this going to be a Q&A from the audience that you'd rather anything in particular on the panel?
So, I mean, I guess useful was to share our various journeys, because obviously we've all started as clinicians, or at least intending to be clinicians, and have ended up in different places. And it's really thinking about what it is that's, you know, directed or guided that journey, and then hopefully open it up for discussions and questions.
Great.
Brilliant.
Who wants to go first?
Okay, I'll kick off again. So I had a very non-traditional route really throughout. When I was going back all the way to school, I was not interested in healthcare, was not interested in medicine. I come from a family of lots of clinicians, so it just seemed like not the route for me, and I actually wanted to be an artist or something in the creative industries. Ended up doing some work experience when I was 16, 17, and completely fell in love with just the whole medicine, hospital environment, the dealing with patients, the diagnosis, the buzz of being on a ward round and trying to figure out what's wrong with somebody when they come in. And I completely fell in love with medicine. So I decided, okay, I'll try and you know, make a crack at this. It's quite late in the game. For usually people have decided they wanted to be a doctor from like when they were this high, but I made the decision at 17. Anyway, so I got into medical school. Whilst I was at med school, I was kind of a little bit, wasn't sure what specialty I wanted to go into. Knew I liked anything that involved a little bit of creativity and art. So I kind of fell in love with the surgical specialties and the craft specialties. So from just general surgery, plastic surgery, and obstetrics and gynecology. I graduated in 2011. So this is pre-change in contract, and taking gap years after medical school was really unusual. At that time, most people went straight into training after doing their foundation training. So after foundation training, I couldn't decide which specialty I wanted to go into still. Thought it was quite a big decision to make at 24. And so I decided to take a year out and just kind of explore my options and also chill out, because I felt like I'd been working really hard since my GCSEs. So I spent a year, just didn't do anything medical related, just enjoyed my 20s for that year, and then decided to apply for gynecology, because I was really, really passionate about women's health and global women's health, and thought I could really give a lot in that specialty as a female, from the point of view of just really being able to empathise and understand what women go through. And yeah, so I applied to obstetrics and gynecology, got in, and then was doing that for a bit. A few years down the line, I noticed a gap in training and some issues with training, and decided that I would find a solution to that, because at the time there wasn't a solution. And that's how I started my entrepreneurial journey. And that kind of, I was starting to get fed up with training, and I was starting to I was starting to get fed up with training a little bit, and I was looking for a new challenge, let's just say. So this kind of came at the right time, and that's how I started my entrepreneurial journey, and found out that actually when I was trying to solve this problem, how do I put this in a coherent way, but basically the part of me that's always been really creative, always been solving problem driven, was really it ticked that box. So that's how I ended up starting my entrepreneurial journey. Ultimately, my first idea didn't quite work out, but these things never do, and that's completely fine. And yeah, so I've been doing that now for been in this sort of space for about 4 years. It led me to meeting the CEO of ORCHA, which is the organization that reviews health and care apps, and ended up getting a role there as a clinical lead in maternal and women's health, which I'm really enjoying, because it means I get to have my finger on the pulse in terms of innovation, know what's going on in the world of femtech and women's health, which is something I'm really passionate about, and also get to kind of work alongside my NHS work. It's quite, when you go into this entrepreneurial world, you end up having to make a decision at one point. Do you want to be a full-time entrepreneur, or do you want to carry on being a clinician? And I'm not at the stage yet that I'm ready to give up my role as a clinician, because I really enjoy that patient-facing thing. But I also love big picture stuff and really making a bigger impact on a bigger scale. So my role at ORCHA kind of allows me to do that whilst I've still got a foot in the door with my NHS work. So I'm doing that part-time, and then part-time with ORCHA as well, and it's been really great. And then I've got another side project on the side as well that I'm working on with a friend of mine. So I'm really excited to see where that goes. But yeah, a bit of an interesting career journey. Not quite the same as other people. Usually it's a conveyor belt, and people get on one end and then get off at the other end, and they don't really have much choice. At one point during my career, I just felt really trapped by it and a bit suffocated because of my personality type. So I had to get off that conveyor belt and do things that really interested me, slow things down a bit, slow down that training pathway. My colleagues are now consultants, and I'm still a registrar, and I'm like, that's okay. I'm doing my thing.
Great, thank you. Who's next?
Brilliant. I think we should explain a little bit maybe what the Clinical Entrepreneur Program is, because I think there's a few questions. So it's a program developed by NHS England. I think it was Professor Tony Young's baby. He was the chap that introduced the idea of creating clinicians to become innovators and entrepreneurs. I think the program's in its 5th year now. So the previous year was my first year. In the first year, they started taking doctors, and I believe second year they took in nurses, and then third and fourth year decided to take in. Henrietta's shaking her head, so I may be incorrect with some of these figures. So I know pharmacists came in at the end.
Yeah, nurses came in on the 3rd year.
So third year, here you go. So it's a platform to help clinicians working within the NHS to develop ideas they already have, or even if they've already started working on the ideas, improve how they expand those ideas, because as we know, NHS is not that great at innovating, and if it does innovate, it takes forever to get anything done. And so it's a good place to network. We meet up every month. If I remember, we have workshops, and it's a good space to. So there's really important people, executives that come up, turn up and give a speech, and we meet with like-minded people as well. So at the moment, it's all happening via Zoom or Microsoft Teams. But yeah, so that's in a nutshell what the clinical entrepreneur program is.
Mm.
Go into your journey, Ghalib.
Yeah, sure. So as I was mentioning, so I've been surrounded by communication barriers from a very young age. So my grandmother was deaf and mute. My mom speaks English with a limited ability. I've got a child with Down syndrome who's got speech and language therapy, and he's got poor hearing as well, and delayed speech. And I've got dyslexia and dyspraxia. So I've always been surrounded by communication barriers. Then at work, in the community pharmacies that I work in, a third of our patients have communication barriers as well. So we're a pharmacy based in central London. Majority of our patients are from social housing, the council estates that surround the pharmacy. We've got a sizable Arabic, Kurdish, Bengali population. We've got a few Chinese patients and Somali patients as well. And then we've got the tourists that come from Baker Street or Marble Arch who've forgotten their medication or have run out of their medication and can't speak English. And pharmacy is the only place in the NHS where we don't have access to professional interpreters. So you have interpreters in primary care, in GP land, you have interpreters in secondary care, but we don't have anything. And we have to rely upon our own bilingual, if we're able to speak Urdu and the patient can speak Urdu, then we rely upon our own ability. But that's some patients, majority of patients speak other languages. And even on top of that, sometimes there's cultural barriers as well. For example, I may not be able to explain to a South Asian elderly lady, how to insert a suppository in a formal manner. So I don't know the formal words. I know the rude terminology, right? The street lingo, but I don't know the formal words. And on top of that, there's the cultural barrier as well. She may not feel comfortable getting that information from me as well, and she may want to get it from another female member of staff who can speak that same language. So you've got the untested language ability. We don't have a professional solution, and hence why we decided to create a software that can translate and print bilingual labels initially, but now we're doing English for the English. So we're standardizing English content and codifying that element, and that helps the transfer of that content from one system to another system, or one care setting to another care setting. So only drug information is poorly transferable at the moment between systems. So for example, as a GP, if one was to write one tablet 3 times a day, you would use a short code, which is 1 TDS, but that's exactly what shows up on the NHS app, which is not great. How is a patient supposed to know what 1 TDS or 1 noctay is supposed to mean? So that's that kind of content we're trying to improve as well. And we're currently in 4 NHS trusts in and around London, most recently in Luton, Dunstable, and we're going to be launching in Bradford as well. And hopefully that's with the support of NHSX.
Thank you, that was great. And Henrietta.
Hi. So Alex would have heard some of it this morning. So how did I start my journey into a nursing career? So like Fatima, I guess I always knew that there were things that I wanted to do with my life in terms of what sort of things really made me tick. And the one thing that I absolutely hated was injustice. So I could not bear people not being treated fairly or things not being fair. So I started off my thinking with, I would love to be a lawyer. And I remember my granddad saying, all lawyers are liars. So that was out of the window. As an 8-10-year-old, I was thinking, I don't want to be a liar. So that was it. That was my law career gone. And then I realized as I progressed through secondary school that I actually loved numbers and anything scientific. I wasn't particularly keen on the histories and reading lots and lots and lots. So for me, it then meant, okay, what careers could I go into? And coming from an African background, it was very much, you either went into medicine, pharmacy, if you were intellectually abled. So it was very much going to be the path for me. So I thought, okay, medicine will work because A, I love interacting with people, and B, I want to help the world. Well, at that time, I wanted to save the world. So medicine seemed like the most appropriate career to progress on. But then again, if you're young, there is a tendency, and if you're young and intellectually able, sometimes there is the tendency to become complacent. So I paid a big price, which is very much, didn't get the grades to get into med school. So what was the options for me then? Nursing. So I then so an uncle said to me, well, sometimes what do you actually want to get at the end of it? Help people. If you were a doctor, you will just, you will have the title doctor. So fundamentally, you could do other courses or other healthcare programs and do a doctorate, and you will still get a doctor. I thought, oh, that's actually a good idea. That's actually a good idea. So I went into nursing, trained, started my career as at a diploma level, trained, went in. I mean, I've always loved, learning, and was a bit of a bookworm initially before I became complacent. So it was always very much easy for me to just get into some academic training of a sort. So straight after finishing, went into doing my degree. Straight after that, went into doing my master's. So for me, it was almost in my mind, I was always going to end up as a doctor, if it makes sense. So that's how I started. And then once I got into practice, lots of interesting things were happening. And again, Fatima pointed the fact that sometimes your personality has a way of influencing the path that you chose. And as a person, I get bored really quickly. I want to keep I want to be excited about things. And for me, routine things weren't very much things that fitted with my personality or the way that I worked. So it was almost always very much around looking at what else I could do. So it wasn't very much a 9 to 5, do what you're being paid to do, get out of here. It was always very much around what's not fair, what's not being done well, how can we improve on things? So that's how I literally worked through my career, which meant that I always had, as I say, a side job as part of my day job. I would look at, applying for funding, setting up programs, looking at projects. So did all of those things. And then like everybody else, sometimes you get to those crossroads where it was very much, I've done pretty much everything there potentially is to do in practice, because I was doing some lecturing at the nursing school. I was facilitating a research forum, and there were times people even thought, oh, is she a doctor? Is she a psychologist? Because as far as lots of people were concerned, this isn't something that nurses typically did. But I did all of those things, and then eventually went into a fellowship, which took me out of practice. So once I did the fellowship, I think it was an opportunity to almost reinvent myself. It was very much around, it did a lot of things for me, apart from the fact that it saved my career in the NHS, because actually, like Fatima and others, I love patient care. And for me, there was something in my mind that always almost felt that the only way I could make an impact was seeing patients and, making that difference to their lives. And then once I did the fellowship, there was that realization that actually there are other opportunities to not have direct patient contact, but still be able to make significant impact on patient care. So whilst in health education in England, I have done some amazing projects and some, I've met some really amazing people. Some of the projects that I did was really supporting the training of early intervention in psychosis workforce across the country. So I think projects like that is exciting because you get the opportunity not only to meet people locally, but nationally as well. Also looked at a project where we could think about the introduction of patient safety and quality improvement in undergraduate pre-registration nursing and midwifery curriculum. Another exciting one, did the TOPO review, which was very much around a technological review of the impact of technologies on, healthcare professional training, selection, the impact on roles. So whilst doing all of that, thank God for social media. In one of the jobs that I was doing, colleagues contacted me one morning and says, oh, Henrietta, we need to set up a Twitter chat for this afternoon. And we've been searching for your Twitter handle everywhere. Can't find it. I said, that's because I haven't got one. So I got set up with a Twitter account that morning. So I got excited, like any new toy, just going through it, thinking, what does this actually do? So on there, I came across NHS Clinical Entrepreneur Program. And I thought, oh, what is this all about then? So I got excited about it, as you do, read about it, and I thought, oh, actually, this might not be such a bad idea for two reasons. As a practitioner, the one thing that had frustrated me throughout practice and through my academic work is understanding and identifying that actually with mental health care, people from Black, Asian, and minority ethnic backgrounds, do not access services that most of the time meet their needs, and B, their prognosis or their outcomes are really poor. And I thought, oh, over the years, it's a known fact. I mean, lots of research evidence has really nailed down the fact that this is a need. However, we have tried so many things, but not technology to address that. So I thought, what solutions can I really bring to the table to address that? And that was the idea that I took. I took through for the clinical entrepreneur application. And again, there is always, I am philosophical in some ways, and I always feel things come together in the end, because whilst I was trying to do the application, all sorts of things were happening, which meant I almost missed the deadline. And then for some amazing reason, I just saw this email pop up and says that we've extended the submission of the application for another week or so. And I thought, God, I mean, so submitted it, went through the interviews, and then got onto the program. And as Ghalib said, it's probably another most exciting thing I have done in my career. Meeting lots of people, learning different things. And I've always, whilst I am ambitious, I'm also realistic that I may not ever make a million, but so what? What has been so important or really interesting for me is actually some of the learning that you do in your entrepreneurial process is actually applicable to clinical care. So, you know, as an entrepreneur, you're almost trained to understand what is the customer's need. How can you make better use of, you know, costs? How can you manage that? How can you improve on the customer's experience? This is very similar to the triple aim in healthcare, which is very much around, you know, the patient experience, the use of better resources, and how you manage the quality of care, which for me is, you know, it's good learning. So there are things that you learn, which really then helps you as a clinician, even if you do not end up becoming, you know, a big multi-million-pound company, you are able to still use those skills. So that's been my journey. I've done some exciting things. I've had some barriers. I have had some days where I've questioned, what's the point to all of this? But fundamentally, there have been more good days and more impact than there has been, why am I doing all of this?
Thank you. That's really interesting, actually. I was going to say, do you think that this is the case of where medicine is very much a process-based system, and you have to obviously diagnose, and often it's less about being creative and building things? Do you think that that's what this is partly about, being able to kind of change things and create and build?
I guess it's different for different people. It depends on where your starting point is. And, you know, some of it might just be, you know, a novel idea that you literally start from the scratch or the unknown. And some of it might be improving on what's already in existence or finding the gaps. I think what you do get told is very much fall in love with the problem, not the solution, as it were, because yes, everybody else can think about the solution, but if you were to actually, you know, bring people along with you and be able to develop a product that gets out there, then you need to fall in love with the problem, because that's the only way you can actually get people to buy in the product. So I guess it depends on where you are starting from and what problem you're trying to solve.
Do you have any questions from the audience at the moment? Just having a look. So Fatima, So is this available to students as well, you said?
Yeah, it's available to students, scientists, pharmacists, nurses, midwives, other healthcare professionals. We've even got like some engineers on the program as well that do innovations for healthcare. So yeah, it's not just for working professionals or medics. We have loads of medical students actually, and we had a couple of medical students join last year, and they've launched like an awesome drone based company delivering like essential supplies during like COVID. So yeah, so medical students and students, do really well there as well. So. And like Henrietta says, it's always lots of people come to the program with ideas, and ideas are great, but they're a dime a dozen. What you really need to do is focus on the problem that you're trying to solve and really do a deep dive into that, because that's where you'll get all your answers. That's how you'll actually make something of value. And yeah, it's an entrepreneurial program, so it's about impact and solving problems, but it's also about making money, and you will get people to buy your product if you actually tap into something that's needed and that people want and need and is a pain point. But if you're going in with a particular solution, it stops you from actually problem solving and finding out where the value is.
Would you say that by being part of the program that it's improved your skills in other departments in terms of your clinical work and how you understand the NHS?
Well, I joined the program quite at a good time because I was starting to it was post contract issues. So I don't know what the range of people are in our audience, but we had the junior doctors strike in 2016, and there was lots of problems with contracts, and a lot of us felt very devalued and demoralized. Lots of people were wanting to leave. There was a genuine exodus of people leaving altogether, either leaving medicine altogether or moving abroad, going to Australia, taking gap years, and kind of not going back into training. And I was certainly one of those people that was just feeling very just overworked, burnt out, and fed up really. So it was a bit of a lifeline, because I was really considering leaving medicine altogether, and that kind of made me fall back in love with why I went into a medical career in the first place. And just from being around so many people who are inspiring and are solving real genuine problems in healthcare, kind of reignited that passion of why I went into healthcare in the first place. When you're feeling like a cog in the machine, it's very hard to see the value that you're adding and the difference that you're making, particularly if you're somebody who's very driven and motivated into making a difference. And that's why you went into a medical career in the first place, whether it was nursing, pharmacy, or dentistry. So for me, it kind of made me fall back in love with obstetrics and gynecology, why I did it in the first place. And it made me more proactive in my job as well. So if I was seeing things that I didn't like, things that needed improving, I was a lot more driven to solve those rather than just complain about them and become complacent. So those were some of the benefits. And some of the other benefits then is just from understanding a little bit about business, understanding a little bit about kind of how to build a business plan, meeting some really key people within the industry, key stakeholders, really important people that are quite high up in the NHS that you would never otherwise meet. And yeah, and it just gives you the title, gives you that badge of honor as well that we always keep saying, of just knocking on those doors that you otherwise feel that you can't access, whereas it gives you that little bit of an edge. You've got gives you just an additional credibility to do those things if you're feeling a bit apprehensive about doing them. There's also, it's an amazing support network. Tony's very invested in all of the entrepreneurs, so he is incredibly supportive and helps open up those doors. It's definitely a program that doesn't spoon feed you. So all the work that and any of the benefits that you reap kind of have to be on your own back, and you have to really work hard for them, because it's not a program that's very proscripted. It's very much like you have to go out and put in that effort to get the outcome that you need. or want.
Okay, thank you.
Long answer, sorry.
No.
So just to add a few points to that, I think, you know, Fatima has really gone into detail about some of the benefits. And I think for me, if nothing at all as well, thinking about even pitching or being able to convey information succinctly in a short space of time is one of the skills that, you know, from the program. So Tony gives you, what is it, 30 seconds or a minute maximum to be able
30 seconds, yeah, 30 seconds.
to be able to pitch your idea, but pitch it in a way that's convincing to your audience. And I think that's a real skill to develop. So as a clinician or for interviews, for whatever other, you know, other parts of your life. And I have found that so invaluable, because now if there's a meeting that everything seems to be running late and they say, oh, there's a couple more minutes, can you tell us what you're doing at Health Education England? I'm able to use that skill, and people usually think, oh, how have you managed that? So there is that. But also for me, it's about, you know, some of networking. I mean, if anybody was on the call this morning, what I said was your career as a clinician should be based, or your whole career should be based on three things: relationship, relationship, relationship. So it's about forming those relationships, it's about maintaining those relationships, and it's about how you use those relationships. And I think that's something else that the entrepreneurial program gives you.
People are just asking in the chat whether it's free, and yeah, the program's free. The application's closed, but it will open up again usually around March time next year. And it's not just for people who are entrepreneurs, i.e. have their own startups, it's also for people that are what are called intrapreneurs, so people who are innovators within the industry or setting that they work in.
How hard is it to get on the program, Fatima? Is it?
I'm not very good to answer that question because I was really quite lucky. I basically had this particular idea, was working on it for a couple of years, completely stabbing in the dark, had no clue about what I was doing, no idea about medicine. Ended up meeting the guy who set up doctors.org.uk because he gave a talk at Birmingham Uni. So I was like, oh, I'll go and speak to him. He's a doctor and he's an entrepreneur. He'll know what I'm on about. Let's go and talk to him. So I spoke to him after the session, and he told me about, oh, there's a guy in the NHS that helps people like you. I was like, oh man, that's awesome. So told me his name. So I looked him up, found him on LinkedIn, sent him a message on LinkedIn. It was Tony Young, who heads the program. And he was like, all right, set up a meeting with me. So I set up a meeting with him, went down to London to meet him for half an hour. I was post nights, we're about to start night shifts. And he was like, why haven't you joined the NHS Clinical Entrepreneur Program? And I was like, what is the NHS Clinical Entrepreneur Program? I have no idea what you're talking about. I've come here so you can help me. And he just basically pitched the entrepreneur program to me and said, apply, it's really easy, blah, blah, blah. And I was like, oh, I don't want to apply. I don't want to take more time out of training. So I ummed and ahed about it for about a couple of weeks. And then I was on holiday in Spain and I was like, oh, what the hell, I'll just apply for it and see what happens. And Tony made it sound really easy. So I thought it was just going to be like some ridiculous application online that, you know, didn't mean anything and I'd get in really easily. And I was surprised to realize that it was a whole actual application that needed references. I thought, oh crap, it's bank holiday weekend, I can't get references from people. But yeah, he just told me about that you have to do an 1 minute elevator pitch, and that was fine. I was like, yeah, I can do that, that's not a problem. But there's like some questions you have to fill in as well. And then there was an interview, and yeah, I got in. But I kind of, I don't know. I don't know how easy or hard it is. I think if you're really, if you're really passionate about a particular problem, if you're, I don't know what the genuine ingredients are. I couldn't tell you how hard or easy it was.
So I have been fortunate actually to sit on both sides. So I have interviewed people wanting to come on the program, and then obviously have been interviewed to get on the program. And it's everything that you've described, Fatima, but and more. I think for me, if you are considering getting on it, there are three things to think about. So you need to think about your credibility or your capability as a person to be able to, persevere and hold on to an idea and turn it into a product. So there is that element of yourself that you need to communicate through your application, through the interview, that you are somebody that has an idea, but you are able to bring people or things together to make it happen. So there is that. There is also the value of the idea itself. What is it that you're trying to solve? And is there a need for it? So you need to be able to come to the table and say, listen, I have looked at this from a number of perspectives. So from a personal experience perspective, from literature or evidence, research evidence, from a number of areas, be able to tell a convincing story as to why you are developing that solution. And the third area is, what impact is this going to make? Because yes, you can develop a solution, but is it a solution that really changes the life of two people? Or is it a solution that has legs to grow and be able to impact significantly on patient care? So I think for me, those three ingredients. And when people come into the interview as well, the one thing that we really, really look at is your leadership skills. There's no point sitting around that table and going, we did this and the service did that. Because remember, this program is about developing you as an entrepreneur. So if you do register as a small to medium enterprise company, you are going to be a director. So you need to start showing or demonstrating your ability to lead a team or a group to get things to fruition. So I would say those are the key things that you need to demonstrate right from application through to interview to have a good chance of getting on.
So on that basis, in terms of things like leadership skills, do you think doing NHS kind of courses in leadership or management is worthwhile beforehand, or?
Don't know if maybe Ghalib wants to chip in, because I feel like I've been talking a lot.
Alex, could you repeat that again, please?
So in terms of things like leadership skills, and where there are some short courses you can do within the NHS, are those kind of things worthwhile doing before you apply for the CE program?
No, I think the CEP program will help. I've recently spoke to Tony and asked for personal development help. So he's previously mentioned, like, I tend to wear my heart on my sleeve, and he knows I'm really passionate about the solution that we've developed. And as I mentioned before, it just takes forever to innovate, to get innovation done in the NHS. It's always, as I said, there's more pilots in the NHS than in the British Airways. So everywhere you go, every hospital, every GP, every pharmacy, they all want free pilots and so forth. And Tony's been a good mentor. I work with him one-to-one. And you don't have to have had, a MBA or any leadership skills kind of programs to have gone on to the CEP. And it's pretty, I've made quite a few applications as a entrepreneur in various different places. So I found it to be quite straightforward, to be fair. And, I thought the process was pretty easy. And I would recommend it to everyone to do as well.
Yeah, I don't think you need a particular course or a certificate to say, yep, you've done this in leadership. I think you just need to show that you've led on a project or shown initiative for something in whatever it is you're doing, whether you're a medical student or been working for a few years. Yeah, I think it's more like showing practically things that you've done. I don't think having a certificate or a degree in leadership would necessarily help or put you at a disadvantage if you didn't have it.
And just to add as well, if you get on the program, there's usually at one point there's this assessment that you get to do, so the Wellbeing assessment, and what that usually shows is almost a profiling of you and where you fit in. So I think whilst I use the word leadership, it's used loosely in the terms of, actually, if you do, for example, something like the Wellbeing, it just shows who you are as a person and where you are most effective. So I think it's basically being able to communicate that in some way. So whilst I say leadership, it's really your ability to hold things together and direct or support other people to get you to where you need to be. But recognizing that actually, maybe I'm not a process person, So when I set up a team, I need somebody that will bring that element to it. Maybe I'm a researcher, maybe. So it's being able to understand you as a person and what you bring to the table and how you bring others together to be able to get you where you need to be.
Yeah.
Great. Ghalib, I've been quite keen to know how the CE programs kind of helped your own project with written medicine.
Our product was, I'd say, fully developed by the time I applied. I'd met Tony a number of times in 2018, and he told me to, apply, and hence I did. Where he was able to connect me with very senior decision makers within the pharmacy world of, pharmacy chains such as Boots and Lloyd's, and people within NHS England, and basically support our innovation informally. So that's the support that we received from the Clinical Entrepreneurs Program. But one of the something even better, I'd say, is meeting like-minded people like Fatima and Henrietta within the program, meeting fellow pharmacy professionals, knowing what they're doing, getting their feedback on my own products and own idea, their connections to their friends or work colleagues or chief pharmacists. It's a network of making connections, and it's a good professional network to be part of. It also, a friend of mine who's a clinical scientist, he was on the Clinical Entrepreneurs Program as well, and being on the program helped him in career progression internally as well.
Yeah.
Okay. I wonder as well, so that I know that with the AFP program, there's a leadership or entrepreneurial kind of route through that. How well does that tie in, Fatima, into things like the CE program?
The what program, sorry?
AFP, Academic Foundation Program.
The Academic Foundation Program. I'm no idea how that ties into the Clinical Entrepreneur Program.
Okay.
I didn't do the Academic Foundation Program.
Okay.
So I would.
So what is the Academic Foundation Program?
It's usually for doctors that want to go down the academic route. Usually, so there's a research element built into the foundation program. So it's not the generic foundation program that most people will go down. It's slightly adjusted so that you get to do a bit of research during it. And
okay.
As far as I know, there's 4 tracks you can follow. So one's research, education, leadership, and enterprise business. I wondered if there's a different route. Is it mixed up with the CE program at all? Or?
We developed a bit since I was a foundation doctor, because there was none of the entrepreneurial stuff back like 10 years ago when I did my foundation training.
It's all changing.
It's all changing, yeah. So I'm not familiar.
Okay.
But yeah, because all the NHS is now, they've now, like, the program's now this is the 5th year. So it's all very much, we need to innovate, we need to improve things. So that makes sense that they would implement that take that opportunity from the foundation program and implement that. So that makes sense. Because then you could, within that program, it's 2 years, isn't it? So you could develop an innovation or an idea during that year. But innovations don't always have to end up being like, multi-million-pound or a unicorn company. They can be just improving things for the trust that you work in. Like I said, there's entrepreneurship as well. It's just as important as entrepreneurship. It's what keeps organizations ahead of the game and keeps organizations like just continue being innovative and stagnant.
To add to that, self-development as well. So the skills, the soft skills that you learn as an entrepreneur, the networks that you develop, because you're not just, if it's a technical innovation or digital innovation, you're working with third-party system suppliers who are supplying systems into the NHS. You find out how contracts work, how tenders work, how procurement works. You're finding out, the cost of the products. Understanding the assurances a product needs, like clinical safety verification, IG guidance, and how you're meeting all of these things before you're introducing a product even into the market. So it's all these soft skills that you're learning. And for me, for example, it's on top of that, policy change, influencing policy within the NHS, making sure the regulator is able to reduce communication and language barriers within the pharmacy world. You tend to meet a lot of people, so it helps build the clinician into an all-round leadership.
Mm.
And so you mentioned that it's open to kind of doctors and nurses at the moment. Is it
No.
open to all healthcare professionals now?
It's open to all healthcare professionals, and it has been, I think, since the 3rd year at least. And it's, as I said, it's open to scientists. It's open to, we've had some medical engineers on the program as well, pharmacists, midwives. It's literally anyone who's got any kind of relationship with the with healthcare and the NHS, because it is an NHS affiliated program. They have to show there's some kind of link with the NHS, but it is, broadly speaking, for anyone who works within healthcare, including engineers.
In my cohort, they took on I think a hospital manager as well. So non-clinicians as well.
Yeah, so it's managers as well. Yes, and the medical engineers, they're not clinical at all. They're engineers.
I guess a key question at this time would be to ask how, seeing as you've got quite kind of digital programs you're working on with ORCHA and with kind of digital literacy, how COVID's affected what you're doing?
Well, it's made things a lot easier. ORCHA as an organisation has expanded a lot during COVID. It's made, in terms of like up until this year, talking about anything digital it wasn't really on people's radar. Now COVID has completely accelerated that. It's on everyone's radar. Everyone's speaking the same language, which has just made it so much easier to try and convince organizations to accept technological changes. You have to understand that in the NHS, people are very overworked. They're, you could say, underpaid as well. There's staff shortages. Lots of people do overtime and they don't get paid for that because it's run on a lot of people's goodwill. So before COVID, trying to get them to use new technologies or new solutions, it's just another barrier to them to do their job. You as the innovator might know that, or the person who's seeking to solve that problem might know that actually if they just learn this particular skill, then actually it will make their lives easier. But you can't see that when you're working on the ground because you're running on zero a lot of the time. So what happened with COVID is it kind of just forced people to just have to do that to deal with the situation that everyone was put in. So it accelerated technological, just acceptance of technology and acceptance of digital. Now, hospital, just even simple things like communicating via Zooms or Teams, that was so far out of what people would accept doing because it was just deemed to be too challenging, whereas now that's the norm. So at ORCHA, we've just been really trying to really take advantage of this window of opportunity that's opened up that's essentially what we've been doing during this time, and so it's really helped.
So it's very interesting points you raised there, Fatima. So I think that actually, so whilst it's created opportunities, certainly for some of us in that world, it's created some challenges as well, because it just means we're working even longer hours because lots of things to be done in a short space of time. So if I give an example for primary care, there was a whole program planned for a year, but as soon as COVID hit, we had to, NHS England Improvement had to get all GPs basically getting various technical equipments to allow them to provide remote care or online consultation and the rest. What did that mean? It meant that we needed some training materials to go alongside that. So we had to work at pace to really get those training materials out there. So it has come with opportunities, but it has come with some challenges as well, because we've had to throw in quite a lot of, technological or digital products without necessarily having a workforce that's skilled or competent to use some of those tools. Now, we at Health Education England, we're doing various pieces of work. So for me, 3 things stand out. We started off this project understanding that when it comes to healthcare or people in healthcare, we've got 3 categories of people. So people who are digitally engaged. So they are the ones that probably ourselves who are saying, yep, bring the digital on because we know that it's going to make impact for the care we deliver and for our patients. There were the digitally ambivalent group who are the ones that says, yeah, I do know that technology or digital helps, but still give me my pen and paper and let me get on with it. And then there is a third group which basically say, go away, I do not do tech. So Fatima is right in saying that actually people have been forced to do it. We say, their hands are tied behind their back because they did not have a choice. I think for me, what's critical is how do we sustain it? Are people going to go back into old ways of behavior when COVID and everything is settled? Or are we going to capitalize on the opportunity we've got now to ensure that people have changed their attitudes to the digital? Because for me, digital is not just about people having skills. It's about people being motivated and people having the confidence to actually use it. And for that to happen, we need to incentivize people to have a completely different attitude and relationship with digital.
Yeah. I think it's because of the situation that's happened, it has forced people to accept it. And so that's where not only has the opportunity arisen to see how we can sustain that after the pandemic is over, but also it's highlighted where there are key problems as well. So, for example, we're doing lots of things digitally. You've got people who are in their 80s and 90s. They don't have Wi-Fi at home. They don't have internet. They don't have a smartphone. How do you make sure that digital doesn't exclude them from being able to access healthcare? So it's not only highlighted opportunities and can we sustain this afterwards, but it's also really highlighted where the problems are and where we need to make sure that we don't exclude these people. And also, people who don't speak English, for example, how do you prevent them from losing out on access because they're not quote unquote digitally literate, which is, I think, is a really patronizing term to use, but that's what they say. But yeah, it's definitely highlighted a lot of problems as well that I think we need to be looking at moving forward.
So I think COVID's helped in one particular way, for example, and telehealth, as Fatima was mentioning, with older people and accessibility. It's at the same time, the technology has been around for 15 years. It would have taken another decade for mass adoption, but COVID literally made telehealth, remote monitoring and remote care happen overnight. Within 2 weeks, GPs had to, all the GPs, 80% of GPs across the country, when lockdown happened in March, had to adopt a remote consultation technology or platform. And that's something that would have taken 10 to 15 extra years.
Absolutely.
So COVID, in a way, has been a silver lining for digital and technology in the NHS to speed up things. But as Henrietta mentioned, at the same time, it's all that education, digital literacy, building a workforce that is able to use these technologies and understanding which one's the better one to use, which one's got its clinical safety certificates, which one has, no IG problems. So, for example, a few GPs in the beginning were starting to use Zoom, and straight away we found out that Zoom wasn't very IG friendly, because all of a sudden random people were coming onto your Zoom call and stuff. And so it's given a good push towards telehealth and hopefully for other digital technologies.
Can I ask one more question? We've got 2 minutes left. Do you think that because of this kind of big push towards digital health, that there'll be a big influx of digital health kind of ideas and solutions that will almost saturate the market more? Whereas beforehand there was more of a gap for kind of these ideas to come through as it was a bit less popular. I think that will now be kind of swarmed with ideas. And
personally, I don't think so. I think, well, there might be a swarm of ideas, and I think that's really going to be a good thing. It's going to create kind of healthy environment of creativity and innovation, and I think there's lots of room and lots of areas to improve, and so I don't think it will become saturated. Personally, I think it will create a really good environment for innovation.
Depends on digital transformation as well. For example, we already have, if you think about it, in the GP land, we've got 4 different systems. 2 of the very big markets leaders are System 1 and EMIS, and system change. So, for example, only 3 to 5% of GPs will change the system annually, right? And there's a whole digital transformations and training of staff members and so forth. So it takes a long time, and even now we're looking at in secondary care, the American systems are coming in and taking over the market space, such as Cerner and Epic and Allscripts, and that's because of the lack of interoperability that the UK system suppliers were not giving. So if you go to Guy's and Thomas's, they've decided to go with Epic, but prior to Epic coming in, they're currently using 800 different systems within one trust. So a lab system, an ambulatory system, a stock control system, a dispensing system, a prescribing system, 800 different systems within that one trust, right? And most of those systems are not talking to each other, right? So that means double entry of data, more likelihood of you making errors because you're repeatedly inputting that same data, which causes patient safety issue, medication safety issue, or clinical safety issues. So there may not be a saturation in that sense, and the new systems are always now looking for adopting a unique selling point as well. So the more of those coming in, that makes you a bit more different from those other systems. So there's always a market open, and innovation, we just need to keep on doing it. If we stop, then there's nothing fresh in the market.
Yeah, there's always going to be new problems that arise that need solving.
I just don't think that innovation is the problem or the ideas is the problem. It's how you get it through the market, or the implementation is where probably need to start focusing a bit more on. So it's not so much about the innovative ideas. It's not so much about developing the product. It's very much around so what. So once the product is developed, how do you get it to the right places and to the right people to use it for the intended purposes? I think that's where, if we're being honest, that's where we're struggling at the moment.
Well, hopefully all of our attendees will be really inspired now to go and do some innovating.
Just to sort of final point, they think bigger than just the NHS, because healthcare is something that's global. It doesn't have to be something that can be adopted by the NHS. You can solve people's problems, healthcare problems outside of that. And just as an example, a lot of the diabetes care solutions, they were sold, patients bought those, and then they lobbied essentially kind of the powers that be to make that available on the NHS, and then they started to creep into the NHS. But it was very much patient-led, and those solutions, they really dive into the problems that diabetic patients face and really solve those. So actually the work was done for them because the patient started pitching the product on their behalf. So yes, think bigger and wider than the NHS, and if there's a problem, really dive deep into that and work hard on solving that, and everyone will be the dream.
Great. Well, I think that's all we have time for today, but thank you very much for coming and talking today. We'll see you.
Thank you. Thanks.
Thank you. Thanks for having us. Thank you.
Bye-bye.